Well, there are many new clinical trials in 2021 coming up to 2022. And first, they're going to be combination studies because despite my enthusiasm for interferons and that of many others now, I think more and more hematologists are beginning to understand that the basic use for interferon depends upon understanding its basic biologic activity over non-specific myelosuppressives such as hydroxyurea. On the other hand, we have always appreciated that too much interferon is bad. And interferon does have significant side effects when improperly used. And that's why we favor low-dose, continuous dosing of interferon rather than high doses of interferon. And we certainly know from the COVID experience that some of the side effects that COVID patients complain of, such as autoimmunity or the lung issues with effects on the microvasculature of the lung, are probably due to over reactive interferon response. So that interferon in the patient certainly has side effects and must be used judiciously. Such effects include autoimmunity, Coombs-positive hemolytic anemia, arthritis, prefrontal lobe dementia, peripheral neuritis. Those are the long-term effects of interferon, some of them. The more immediate effects, as we all know, are those that are associated with viral infections, because interferon was so called because it was a response of the body to a viral infection. And thus we have patients complain of pains and aches, arthralgia, but these are dose-related and usually subside relatively promptly, may be related to the type of interferon used, as I've already mentioned, and can be relieved by many antipyretics.